Post-traumatic stress disorder, or PTSD, results from a traumatic event in the subject's past. When one is afflicted, he or she has a damaged fight or flight response. A person can be genetically predisposed to be easily afflicted with PTSD and then the traumatic event that triggers it. There are 3 types of stressors. Type 1 stressors are events that are unexpected and beyond what would happen on a daily basis. For example, the 2004 Indian Ocean tsunami. Type 2 stressor events happen over long periods of time when a person is exposed to trauma many times repeatedly. For example, a soldier in a war zone. Type 3 traumatic stressor events produce long traumatic problems but are combined with low stress level events. For example, children who grow up neglected.
Mom!
Yes?
Do you hear the rain?
What rain?
The rain, Mom, the rain!
I don't hear any rain.
I hear it outside. It's the same rain.
I think you need to see someone. I know a great therapist named Dr. Singer. I think you should see her. I'll give you her phone number.
Hi.
Hi. Do you have an appointment with Dr. Singer today?
Yeah, my name is Ria Patel.
Ria Patel at 9:30?
Yeah.
She'll be right with you. Please take a seat.
Ria, I'm Dr. Singer.
Hi.
Please, make yourself comfortable. So, what brings you here?
Well, I just don't feel like myself lately. I can't even get out of bed. I can't face the rain. I just don't recognize myself anymore.
The rain? Outside?
Yes, the rain, but it's so much more.
What do you mean?
The rain, it reminds me of Katrina. I can't face it. Please help me.
Let's see what we can do about that.
There's a common misconception that only soldiers returning from war zones experience post-traumatic stress disorder. This is untrue. Anyone can get the disorder after experiencing a traumatic event, like a storm. In this case, Ria got PTSD from experiencing the horrors of Hurricane Katrina. The main symptoms of PTSD are avoidance, intrusion, negative altercations, incognition with mood and arousal, and reactivity. Not all people who suffer from these tragic events have PTSD. Only if the symptoms worsen or last for many months may have the disorder. Symptoms may begin within 3 months of the traumatic event, but sometimes much later in the future.
What makes you say you don't feel like yourself?
Sometimes I can't tell if I'm awake or dreaming. I can barely communicate. The only feelings I can possibly feel are those from Katrina.
What happened during Katrina?
My house was swept away. I watched as the storm swallowed the home in which I grew up. We were without proper shelter or clothing for 10 days. I saw the bodies of those animals and people deceased float around me. These images are ingrained in my mind. I'll never be able to forget.
What do you feel now?
Well, I try not to feel, but when I do, I feel anxious, depressed, jumpy, and paranoid. I also feel slightly mad.
Mad? Why mad?
Why did this have to happen to me? We had a beautiful life in New Orleans. We had a family, friends, a home. We had it all. And now everything's gone.
How does your family stand now? Is everything okay?
Well, we relocated to Cary after the storm. Now I go to a wonderful school. I have friends. But although this may seem perfect, I still feel really vulnerable.
Women are 50% more susceptible to developing PTSD than men. Teenagers are also more likely than adults to be affected by traumatic events. Because Ria is both a teenager and a girl, she was affected more than, say, her mother. This doesn't mean that men or adults can't have PTSD. It just means that they're less likely.
Have you ever seen anybody about this before?
No, I haven't.
Have you ever self-medicated?
No, but my friends who are also in the storm did.
Alright, well, in addition to face-to-face therapy, we're going to start you with biomedical therapy. I believe you have something called PTSD, aka post-traumatic stress disorder. Your doses are going to start low, but as we continue, they will titrate up until we get the desired reaction. That is, until you feel better.
Okay.
Drugs for PTSD work on neurotransmitters like serotonin, norepinephrine, GABA, and dopamine. The most common drugs to treat PTSD are SSRIs. These are selective serotonin reuptake inhibitors. Because those with PTSD usually have too little serotonin, SSRIs keep serotonin from being reabsorbed. This mimics having more serotonin than patients usually do. These work best for those who do not have war-related PTSD. Antidepressants like Zoloft and Paxil are often prescribed to combat PTSD. These drugs do not completely get rid of PTSD, but they do lessen the symptoms in conjunction with face-to-face therapy.
So that's it? I just need to take medicine and I'll get better.
No, you'll also need cognitive behavioral therapy.
What's that?
First, I'll give you a comprehensive day-to-day plan of your treatment. Then I'm going to help you change how you think about your trauma. You'll look back on it as a learning experience and the pain will finally fade. I'll also teach you ways to implement this new way of thinking in your day-to-day life. You may want to consider EMDR. It's a more abstract type of therapy, but it usually works for patients with PTSD. Follow my fingers. What is your distress level on a level of 0 to 10?
Not much. Probably 0 to 1. So that's it? I just need to take medicine and I'll get better.
No, you'll also need cognitive behavioral therapy.
What's that?
First, I'll give you a comprehensive day-to-day plan of your treatment. Then I'm going to help you change how you think about your trauma. You'll look back on it as a learning experience and the pain will finally fade. I'll also teach you ways to implement this new way of thinking in your day-to-day life.
1 year in the future.
Mom? Yes, Rhea?
Mom!
Yes, Rhea?
Do you hear the rain?
Yeah, I hear the rain. Is there something wrong?
No. No, I hear it too and it sounds nice.
Oh,
I think I like the rain.
that's great. You're not afraid anymore?
No, I'm not. I can't wait to let Dr. Singer know. Hello, Dr. Singer.
Oh, well, hello, Rhea. You look well.
Thank you. I feel good too. I really think the therapy's working.
That's good. I'm happy to hear that. You see, with PTSD, with a good recovery process, it's something you can easily recover from.
Throughout Rhea's treatment, she's overcome her fear of storms and rain and feels better than ever. She continues to go for follow-up visits with Dr. Singer to ensure she's back on track. She's enjoying her life in Cary and has taken up many hobbies to keep herself busy and not concerned with her past trauma. Her life has been taking a positive turn. PTSD can be treated.